Welcome back to Medical Monday. We're so happy to have you join us right here on News Channel 5 Plus. I'm Casey Mason, and tonight we are so happy to have Orthopedic Surgeon Dr. Gautsch here joining us. And you brought a guest tonight.
I did.
Hi, Tammy. This is Tammy. Let's see here, Tammy Weatherford, right?
Yes.
Tammy Weatherford. We're happy to have you on. Where are you from? The Middle Tennessee region?
I am.
You
I'm
said
from Gallatin.
Gallatin. That's right. Well, we're happy to have you on tonight. Thanks for coming out to our station this evening.
Thank you for having me.
So we have you here for a reason. Dr. Gautsch, I'll kind of let you take it away, how you guys know each other.
Well, Tammy came and saw me as a patient, but I've known other people that she knows.
Unfortunately. So Tammy, tell us a little bit about your story. What happened?
Well, it just, my knees hurt. It was hard for me to get up and down. Steps really hurt. And the only way I need to describe it to him when I went in was my knees squished. I mean, you could, if there was no other noise, my knees, they squished when I went up and down steps.
The medical terminology of squishing.
Right, squished.
Oh no, we don't want to squish.
Well, I squished.
So that was kind of when you first realized, hey, something's not right.
Yeah, when it got to the point it was drowning out other noises in the stairwell, I went.
Okay, and so tell me about your experience. You went in, and kind of what took place after that for folks who've maybe never had to go through this process?
Well, he sent me for an MRI. I was 49 when I went to him, which evidently is fairly young to have knees in the shape mine were in. So kind of got the feeling he really thought I was kind of fudging some, but he sent me for the MRI, and sure enough, he said my knees were like a mirror image of each other. They're both knees are bad. So we tried to avoid the surgery. He did the shots, the what, cortisone, is that what they, and then we did that gel type stuff. I mean, we dealt with it for about a year before I actually did the surgery. So finally I said, okay, I want to do it, I want to get it fixed. He doesn't like to do both knees at once, because I was like, let's just do them both, and he said, no, you know, you run a greater risk of problems if you do them both. So we did the right one first, because I'm right-handed, so I thought, well, that'd be the best one to go with. And he sent me to my primary care physician to have the heart and all that done, and I had the surgery on a Thursday. As soon when I woke up, they told me as soon as my kidneys functioned I could leave, so I immediately threw the covers back and said, okay, let's go, and the nurse was hollering and telling me to wait.
You're ready to rock and roll.
Yes.
Must have been a pretty fairly, you know, normal, standard, successful procedure.
And then I went for my first therapy on Monday. They told me to come in on a walker, which I did, and as soon as I walked in with it, they set it to the side and said, now I don't ever want to see you with this again.
Wow. Was that at all what you expected?
I didn't know what to expect, really.
I don't think a lot of people do.
Yeah.
Watching tonight's show, I'm sure, you know, this is something a lot of people, unfortunately, will have to face at some point. It sounds like you had a great experience.
I did. It was rough. I'm not going to say it was, you know, it was rough. The therapy was very intense, and it was rough. That's all I can say.
That's all I can say.
It is a lot of work. It's a lot of work.
It is. And they
the therapists hold you to task.
Yes, they don't let you wimp out of it.
Now tell me about going back in for knee number 2. How was that experience?
I haven't done that one yet.
Haven't done that one.
I can't quit hurting other body parts long enough to get that done.
Yeah, we had to take care of a shoulder problem, I'm afraid.
Let's go into that. So tell us, doctor, a little bit about, this was the rotator cuff. Now we're going to move from the knees to the, shoulders.
Let me supplement a little, if I can, Tammy, with the knee. So it is a lot of work. And you can tell people everything that's going to happen, and it's still, until you do it, I think it's probably like going through a lot of big things like pregnancy. You might think you know what it's going to be like. Of course I don't, but then you actually have to do it to find out what it is. Parenting, you don't really know what it's like to parent until you have a kid. So, so there's about a 6-week window of time when the scar that's going to forms, and it's super important that we try to gain all of the motion. We can work on strength and endurance later, but we try to gain all of the motion that we're going to get in that first 6 weeks. And that's part of what makes it really intense, is because you're working really hard on getting your motion. And it's like, you know, doing a crash course in yoga. I mean, it's a lot of stretching and
things that you take for granted that are nothing, you know, on a daily, when it's kind of like learning to reuse them again.
A little bit.
And it's
because it's a new configuration, and also what happens sadly is that often when people get arthritic, their activity level goes down and they lose a lot of their fitness, even if they're trying to be active. And so a big part of the therapy also is getting kind of back in shape too. It's common that people will finish their therapy having lost some weight and not realizing when they first start it how weak they've become. So the therapy is about the motion, it's about strength, it's about endurance, so that you can take full advantage of the new knee.
Now, Tammy, I wanted to ask you, after going through the first knee surgery, what's some advice that you have for folks? What is something that you learned and you really just want to share with others? If you could kind of go back and tell Tammy advice before surgery, what did you learn? What do people they can learn from your experience?
I do regret waiting so long to have it done.
I hear that a lot with a lot of our medical Mondays.
Yeah, I regret waiting for so long. And another is you need to listen to your doctor. You know, do what they tell you to do.
And go ahead and take that answer there with you. I'll let Dr. Gautsch fill us in from there.
Well, you know, I've been down this path many times, and we've got a team of people, therapists and nurses, and you know, the doctor obviously, and so we've learned where some of the traps are. And the ideal thing, of course, is to guide somebody through something like this and the recovery, and help them to avoid the traps. It's inevitable sometimes, and we can still get back from it, but it can go a little better sometimes, I think, if you follow the advice that we give you.
I'd say so. We probably should do that.
Yeah, but I mean, if you go in prepared, as Tammy did, and ready, as Tammy was, and in fact, I've never had a patient say to me, gee, I wish I'd have waited another couple of years. I mean, it's almost universal that people say, gee, if I'd have known it was going to be like this, I'd have done it a long time ago. But she's young, and we try not to do it when you're too terribly young. We try to get people to at least 50 if we can, just because we know that they aren't going to last forever. They're man-made mechanical devices. I think we can reasonably expect 20 or 25 years out of a replacement. I think I mentioned to you before that I've been putting them in for more than 20 years now, and nobody has worn one out yet. But they eventually will, and it would be ideal if we could do one surgery one time and have it last the rest of that patient's life, if we could. Now, in truth, the replacements that we're putting in now are modular. You could go back in and replace one part of it if it starts to fail, but we'd prefer not have to do that. So we try to get people into their 50s. If you're in your 50s, certainly if you're in your 60s, there's a very high probability that you'll be able to have that surgery one time, and it'll last you as long as you need it.
Understandably. We do have Rusty on line 2 now. Thanks for calling in. What's your question for us tonight?
Yes, this is Rusty. Well, I had a question about knee surgery and knee replacements. Probably 2 different knee replacements.
Yeah, what's your full question tonight for us?
No, the question is how I'm 62 and I'm a little concerned about my age, and could I, number one, a lot of people actually do both knees at one time.
Yes.
And what's the problems with doing that, or will they normally do that on the replacements? And what's the outlook for that?
Well, that's a great question. A couple of questions, actually. So the average age for knee replacement right now has actually come down to about 62. So you're kind of right in there where most people are having replacements. It's become so common that now, if you look at people who are in their 80s, fully 15% of people who are 80 or older have had a knee replacement already, or are going to. I mean, it's just, we're outliving our joints. But as the technology's improved, and as our desire to remain active has continued on, despite the fact that we're 60. I mean, here you are 62 years old. Odds are good that your grandparents, when they were 62 years old, were spending a lot of time in the rocking chair. They weren't out trying to do all the things that you're trying to do and want to, and couldn't. But now we can replace knees. So you're right, kind of in that zone where people are needing to get it done. Yeah. So age for you is not a consideration. Doing both at the same time is kind of a mixed bag. So When you do both at the same time, the problem from my perspective is twofold. The most important of which is that the risk of complication more than doubles. So it's not just twice as bad, it's more than twice the risk of having bad things happen. Now, bad things are rare, fortunately, with knee replacement. But the risk of infection or blood clots or heart attacks or strokes is real. It's not zero, and it more than doubles if you do both at the same time. A couple of good studies have shown that. The studies that show any difference show that it's riskier. So I always tell all my patients that. Despite that, some people still say, well, I just want to do both of them at the same time, I'll take my chances. If you're in good health, if your heart's good, your lungs are good, you can do it. Now, you can't do it as an outpatient yet. We've not even attempted it. But when you go to get up, you've got a problem because you don't have a good leg to stand on at first, right? So it's tougher to have both done and to get up and go. And it takes longer. And when I do both knees in a patient, their recovery is often about 10 weeks to 12 weeks long, just because it just slows you down. You know, you get tired. I also have 2 daughters that are about to turn 19. Hello, Sarah and Emily. And they're 2 out of my 8 children, which is one of the reasons I moved to Tennessee. But if you asked them, they would tell you that neither one of them got enough attention. Actually, probably all 8 of my children would tell you that. But the fact is that if you have twins, you know, or 2 that are the same age, it is really difficult to kind of, your attention is always divided. And I think when people are trying to rehab both knees at the same time, their attention is kind of divided. Can you do it? Yeah. But I don't see people who do both at the same time hitting the same heights that people who do them staged do. So for some people, we'll do a knee replacement outpatient. They'll go home the same day. By the time that they're about 4 weeks, usually they're recovered sufficiently that that's their good knee. And then we can do the second knee, and we still get, in another 6 weeks, the whole business done in about 10 weeks, and they're better off, and the risks are lower. So that's a long way of saying you can do both at the same time. It's technically easier for me, you're right there, but it's a little bit more challenging for the patient, and a little riskier. That's the downside.
I like the twin analogy. That was a good way of putting that. All right, well, we're going to go ahead and pause for another quick break. Rusty, thank you so much for calling in. Keep it right here on The Plus.